Hi, a very good afternoon everyone. Today we will be talking about evolution of NTB strategy and what is the National Strategic Plan 2017-2025 of Government of India. As we all know, our Honorable Prime Minister has committed that we will be eliminating TB by 2025. So it's very important to see from the lens of the global strategy, how it has evolved over the period of time, and what is the National Strategic Plan for a TB from 2017 to 2025. Right. So if you go and see evolution of NTB strategy, it goes back from a very one of the very profound and prominent strategy called DOT strategy. So the DOT strategy basically it talks about the government commitment. There should be a strong government commitment. There should be diagnosis by sputum smear microscope. We should also follow the DOT strategy, which is directly observed treatment, and the last one is we should have adequate supply of the anti-TB drugs. So this DOT strategy basically started from 1994 and almost all the countries adopted it. And gradually in 2006 we have a stop TB strategy. Now this stop TB strategy is just an extension of the DOT strategy, and it talks about how can we expand and the quality of DOTs which we were providing. We also started talking about the TB HIV comorbidity and the drug resistant, basically MDR TB at that moment of time. Now to have a holistic approach, we also want our health system to strengthen. We need to engage all care providers, and we want to empower patients and communities, and research, as we all know, we need to promote continuously, and it should be an ongoing phenomena. Then the Millennium Development Goal ended in 2015, and then SDG came from 2016 to 2030. So then we had a new we have a new strategy now which is still running, that is called NTB strategy, and it is just a paradigm shift from the past global TB strategies. Now, so what is this NTB strategy? Let's try to understand this. Now, this sustainable development goal, it started in 2016 and it ends in 2030. So there are lots of strategies which have been framed. For example, we are talking about TB strategy, we have a malaria strategy, we have a HIV strategy, we have NCD strategies. So we need to have a holistic approach towards all these strategies, right? So first we talk about NTB strategy here, because we are discussing TB here. So what is the vision? What is the vision of the NTB strategy? The vision is, can we have a world free of TB? I don't want to see a world where TB disease exists. I want a world free of TB where we have zero deaths due to TB, we have zero disease and suffering due to TB. So this is the vision of this strategy. And the goal is definitely to end TB epidemic. Now, whenever such strategies are framed, the indicators which are kept, the broader indicators, revolves around morbidity and mortality, right? So let's talk about the first indicator which has been kept is mortality. Can we reduce the number of TB deaths? So yes, we can definitely reduce, and we are reducing it. So what they have done, that 2015 was considered as the baseline, and from there I want to reduce by 35% in 2020, 75% 2025, 90% 2030, and 95% by 2035, which is NTB strategy ends there. SDG ends in 2030. So for SDG it is 90%, for NTB strategy it is 95% in 2035. So 35, 75, 90, 95. Then we talk about the morbidity pattern. We also want to reduce the number of TB cases, number of TB incidence rate compared to 2015. So when we see 2015 as a baseline, we want to reduce by 20%, we want to reduce by 2020 by 20%, 50% by 2025, 80% by 2030, and by 90% in 2035. And if I go by the number, the incidence rate, it should be less than 85 per 1 lakh in 2020, then it should come to less than 55, then it should come to less than 20 by 2030, and it should come to less than 10 by 1 per 1 lakh. So this is the two strategies. First talks about deaths. Please reduce the number of deaths and the percentage 35, 75, 90, 95%. And second talks about the incidence rate 20%, 50%, 80%, 90%. And the third one is very easy to remember. I want to reduce, or I want to, the cost which a TB patient or the TB affected family has to bear, it should be 0%, 0%, 0%. Means the catastrophic cost, the burden of the treatment should not be too much on the family, and we don't want that the catastrophic cost should be there. So it should be 0%, 0%, 0%, 0%. So the family the out-of-pocket expenditure should be very less. The family should not have the burden of the TB treatment, right? Now this is the numbers which we need to accomplish. Every country has to move accordingly. Now, so what happens? Just see. So there are certain strategies, there are certain pillars which have been framed. So if you see, one of the important pillars, the strategies, one of the important strategy is every country should have strategy and targets at the country level. So every country is in different positions, so they should have their own strategy. Like Government of India, India has got a national strategic plan. So we have a strategic plan and we have our own targets, and we need to also collaborate with the global players also. The second strategy is we need to also protect and promote human rights, ethics and equity. So every patient, irrespective of socio-economic status, urban, rural, anything, they have the right of getting treated, and equity pattern should be maintained. Those who require more should get the most. The support of civil society, support of community, we need to make it more stronger, more resilient, and the accountability and stewardship of the government should be there with very effective monitoring and evaluation. So if we have a good strategy, we have an equity-based approach, the community is empowered and supporting it, and the government is taking an ownership, this will help us to execute the three pillars. And the three pillars are: can we have an integrated patient-centered TB care and prevention? The second pillar, can we have a good, bold policies and supportive system? And can we strengthen the ongoing research and innovation in TB? Okay, so let's take pillar one by one. The pillar one talks about the patient-centered TB care and prevention. It should be integrated. What does this integrated means? Can we have a preventive treatment of persons at high risk? Can we strengthen vaccination against TB? Can we diagnose the TB at the early? Can we adopt screening of high risk groups? Can we treat the drug sensitive TB, drug resistant TB, and can we provide patient support? Like Government of India is providing Nikshay Poshan Yojana, 500 rupees for nutrition. Can we manage other comorbidities effectively associated with TB? So this pillar one talks about integrated care, right from preventive, diagnostic, treatment and management of comorbidity. Pillar two talks about the strong policies and system which need to be strengthened. So there should be a strong political commitment, there should be social protection, the private players, the private care providers, private health facilities should be engaged, should be roped in. They plays a very important role in TB elimination. And can we have a universal health coverage policy which will give boost to TB elimination, where everyone should have access to TB treatment and prevention and other diagnostic care without financial hardship. That is very important. The third one talks about the intensified research and innovation, the new discoveries, the new drugs, like we have molecular test, we have the new drugs like bedaquiline, delenamide coming, and so the ongoing research should be strengthened, new tools, strategy and intervention should be developed, and we need to strengthen this research to promote innovations. Now, so this was the NTB strategy. So, if I can summarize, NTB strategy talks about reduction of morbidity and mortality. The only thing which you have to remember is the numbers: 35%, 75%, 80%, 90%, all those numbers. So, morbidity and mortality reduction over the period of time, and the third one was catastrophic cost should be 0%. And what are the strategies? Every country should have a good strategy, a national strategy. The equity based approach, we should have, and then the collaboration, civil society collaboration, community empowerment, government ownership, and we have this platform ready. Then we have three pillars which we need to execute. We should have integrated patient care, we should have a good policy support system, and the research should be strengthened. Done. NTB strategy finishes. Based on that, Government of India has also taken a step, and they have moved forward and they have developed a 2017-2025 National Strategic Plan. So it has got 4 pillars, which is called DTPB. So D stands for detect, T stands for treat, P stands for prevent, and B stands for build. So we need to detect. So we need early diagnosis of drug sensitive TB, early identification of drug resistant TB, and let's rope in the private players because they plays a very important role. Can we have anti-TB treatment for all the patients, and we should have a patient-friendly system, social support, and the government should take initiatives to ensure that everyone, irrespective of place distribution, urban, rural, socio-economic status, should get the adequate treatment required. We need to also ensure the emergence of TB in susceptible population. We need to prevent that, and we need to provide enabling policies. We need to strengthen institutions. Nowadays, medical colleges are also involved in TB elimination program, and they are having a core committee meetings on a regular basis. The government is trying to rope medical colleges, private players, everyone, and the training of human resource with enhanced capacity is also very important. Now, based on the National Strategic Plan DTPB strategy, the National Strategic Plan for TB also has certain indicators. Just like we have NTB strategy indicators, here also we have the indicators. So we want to reduce the TB incidence by 2025 to 44 per 1 lakh. We want to reduce the prevalence rate to 65 per 1 lakh in 2025. We want to reduce the mortality due to TB to less than 3 per 1 lakh, and the catastrophic cost should be definitely 0. So if we want to eliminate TB, we need to achieve the incidence reduction to 44, estimation prevalence rate reduction to 65, and mortality due to TB to 3, and catastrophic cost to 0. So this is the India's National Strategic Plan, which talks about we have made a good effort. We are toiling hard, and definitely we may achieve the elimination. But we have to be very vigilant. We have to be very focused, and each one, the government, the private players, the public sector, the private sector, the community has to come forward, and self-reliance should be there to eliminate TB. So this is all about National Strategic Plan TB of Government of India. So with that note, I hope National Strategic Plan and TB strategy, the evolution has been discussed, and it would be easy for you. Thank you, students, for watching this. And in case you like, please subscribe my channel. I'll come with another topic soon. Thank you very much. Take care. Bye bye.